What is miscarry? Abortion. The other names of miscarry: abortion, reasons, signs, treatment, precautions, and tests required to identify miscarry, abortion. Miscarriage, also known as spontaneous abortion, is the loss of a pregnancy before the 20th week of gestation. It is a common occurrence, with approximately 10 to 20% of recognized pregnancies ending in miscarriage. Other terms sometimes used include pregnancy loss or early pregnancy failure. 1. Causes of miscarriage: genetic or chromosomal abnormalities. Most miscarriages are due to chromosomal issues that prevent the embryo from developing normally. Hormonal imbalances. Low levels of essential pregnancy hormones, such as progesterone, can affect pregnancy viability. Infections. Certain infections like rubella, cytomegalovirus, and sexually transmitted infections can increase miscarriage risk. Chronic medical conditions. Conditions like uncontrolled diabetes, hypertension, or autoimmune diseases, such as lupus, increase the risk. Uterine or cervical abnormalities. Structural issues like an abnormally shaped uterus or a weakened cervix can affect pregnancy maintenance. Lifestyle factors. Smoking, excessive alcohol consumption, drug use, and exposure to certain environmental toxins can all increase miscarriage risk. Age. Women over 35 have a higher risk of miscarriage due to age-related changes in egg quality. Previous miscarriages. A history of multiple miscarriages can increase the likelihood of future pregnancy loss. 2. Signs and symptoms of miscarriage. Vaginal bleeding. Often the first sign of miscarriage, though not all bleeding leads to pregnancy loss. Cramping or abdominal pain. Pain can be mild to severe and typically occurs in the lower abdomen or lower back. Passing tissue or clots. Tissue or blood clots from the vagina, often accompanied by significant pain. Loss of pregnancy symptoms. A sudden loss of common pregnancy symptoms, such as nausea or breast tenderness, though this is not always indicative of a miscarriage. 3. Treatment of miscarriage. Medical evaluation and management. Expectant management. In some cases, the body naturally expels pregnancy tissue without intervention. Medications. Medications like misoprostol may be prescribed to help expel remaining pregnancy tissue. Surgical options. A dilation and curettage (DNC) procedure may be necessary to remove tissue if bleeding or pain is severe or if the tissue does not expel naturally. Emotional and psychological support. Miscarriage can be emotionally challenging. Counseling, support groups, or therapy may help in coping with the loss. Follow-up care. Regular checkups after a miscarriage ensure complete recovery and assess any factors that might increase future miscarriage risks. 4. Precautions against miscarriage. Healthy lifestyle. Avoid smoking, alcohol, and illicit drug use. Maintain a balanced diet rich in nutrients essential for pregnancy. Regular prenatal care. Early and consistent prenatal care helps detect and manage risks that could affect the pregnancy. Manage chronic conditions. Control conditions like diabetes, thyroid disease, and hypertension under a doctor's guidance. Avoid environmental toxins. Limit exposure to harmful chemicals or radiation, which may be linked to miscarriage. Healthy weight and exercise. Aim to maintain a healthy weight and engage in moderate exercise, as advised by a healthcare provider. Reduce stress. Although stress alone does not cause miscarriage, reducing stress can benefit overall pregnancy health. 5. Tests to identify miscarriage. Ultrasound. An ultrasound confirms fetal heartbeat and development. Lack of fetal heartbeat or abnormal growth may indicate miscarriage. Blood tests. HCG levels. Measuring human chorionic gonadotropin, HCG, levels can indicate pregnancy viability. Low or falling levels suggest miscarriage. Progesterone levels. Low levels may indicate a non-viable pregnancy. Pelvic exam. A doctor may perform a pelvic exam to check for any tissue passage and assess cervical dilation. Genetic testing. In cases of recurrent miscarriage, genetic testing of both partners may help identify any chromosomal issues that could affect future pregnancies. Tissue analysis. After a miscarriage, testing of the expelled tissue can sometimes help determine the cause. Miscarriage is often a natural event, and in many cases, it is not preventable. With medical support, most women who experience a miscarriage go on to have successful pregnancies. Identifying and managing any risk factors, alongside regular prenatal care, can reduce the likelihood of recurrence.
Thank you for watching. Please like, subscribe and share our channel, The Amused Notebook.